So tonight we're going to be talking about several things. The first of which is we're going to talk about the state of older adults' mental health, and specifically talk a little bit about depression. We're also going to talk some about anxiety later on. And then how can we actually look after our mental well-being? What can we do to keep ourselves mentally healthy? And then very important in this time we've been through for the last 9 months is how to build mental resilience during the pandemic. And I know some of you are thinking, well, why should we know this now? We're almost through it, we're getting vaccines, but the truth is we're gonna have to deal with a lot of those same issues of isolation for at least 6 to 9 months, if not longer from now. So what is mental health? Well, a really simple way of explaining it is it's how we think and feel. It's our outlook on life, it's how we're able to cope with life's ups and downs. And it is a very essential part of our overall health. So when we look at older adults, it's important to know that 1 in 4 of adults who are 65 years and over can experience some type of mental health concern. The most common of these are depression, anxiety, and cognitive impairment. We aren't going to be speaking specifically about cognitive impairment tonight, but we will talk about some things that may help prevent the development of cognitive impairment. But if you look at the little word diagram here, these are all the sorts of things that people can experience with their mental health or lack of mental health. So let's talk about depression. As we get older, obviously we get a lot of other illnesses, and with that, our rate of depression also increases. And somewhere between 11.5 and 13.5% of older adults have depression, and that's double what the rest of the adult population suffers. Almost 5% of seniors have experienced a major depressive disorder in the last year, so it is very common. So who actually is the person who struggles with depression? It can be anybody, and if you look at these statistics, as you can see, the chance of being depressed does get higher as we lose more and more of our independence. So 1 to 5% of elderly people who live independently in the community have depression, 11.5% of those who are hospitalized. If people need health assistance at home, it can be about 14% of those people who have depression. If you need to live in an actual nursing home, then 29 to 52% of the population there can develop depression. And people who are seriously physically ill can have 39 to 47% incidence of depression. So what does getting depressed do to us besides obviously making us feel terrible? Well, as we age, depression is really a problem in terms of complicating the treatment of other chronic diseases we might have. And older adults who have depression often need to visit the doctor and emergency room more often. They use more medications. They often have higher outpatient charges in terms of having to visit the doctor in the ER. And if they're in the hospital, they often stay longer if they have depression as a secondary problem. Suicide is a really big deal as we age, and especially in men. This is a list of suicide rates per 100,000, and it's from 2016, so it's not necessarily the most up-to-date data. But this is what the CDC had available. Men 65 plus have a 32.3 suicide rate, 32.3 people per 100,000, whereas women over 65 are only at 5.2%. So women seem to peak with their suicidality in more middle age of 45 to 54, whereas men, it goes up and up and up as they age. So Even though older adults only comprise about 12% of the US population, they account for almost 18% of all suicides. And people who are 85 and older have the highest suicide rate of any age group. There's a statistic that white men who are 85 years and over take their lives at 6 times the rate of the general population. So it is not a small problem. So what about depression itself? I mean, obviously the worst thing that can happen with depression is suicide, but there are other levels of it too. So, you know, what's going to make you more likely to develop depression? Well, women actually do develop more depression over age 65 than men, even though the suicide rate in men is so much higher. Certainly, if you're on certain medications that can change your mood, that may make it easier for you to develop depression. Chronic illnesses and chronic pain are certainly one of the things that can lead to depression. Being disabled clearly also can contribute. If you don't have family support and you're spending a lot of time alone and you don't have a good social network, those are things that can cause you to be more likely to become depressed. Not sleeping well is another trigger for depression. Clearly, if one abuses alcohol or other drugs, that increases the likelihood of depression. And even just going through any kind of stressful life event, which unfortunately we all know there's a lot more of those as we age. We lose friends, we lose family members, and those certainly can increase our risk of depression. So one of the problems, especially in older people, is we sometimes miss the signs of depression. And with older citizens, you know, a lot of the times people think, well, is it just me feeling tired? Is it just because I hurt all the time? And less than 30% of older adults actually end up getting proper treatment for their depression. And again, as I was mentioning, it can be confused with a lot of different types of illnesses. Seniors do tend to ignore their symptoms, thinking it's just normal to feel this way as you age. And those, in turn, are some of the stereotypes about aging. And the other thing is sometimes family members may think, oh, you know, it's just because your social support system's changed and you have to now live in assisted living, and it's not depression, it's just because you're unhappy that you have to go to assisted living. So these are things we really need to be careful to watch for in older people. Some of the warning signs of depression in the elderly are feeling really empty. Sometimes anxiety can be a sign of depression. When people start feeling guilty or worthless or helpless, they stop having interest in hobbies that they used to love, really just feeling pessimistic, feeling fatigued, feeling just like everything's slowing down. And then it's important to know that sometimes having difficulty concentrating or remembering or making decisions is not necessarily a sign of cognitive decline, but can be a sign of depression as well. So it's very important if somebody's having memory problems to really tease out how much of it is true cognitive decline and how much of it could be depression. Obviously, if people are thinking about death and suicide, that is a warning sign of depression. Sometimes people just stop eating, or their appetite really changes where they suddenly start eating a lot and gaining weight. And there's also many physical manifestations of depression, especially in the elderly, where you can have different aches and pains or problems with your digestive system that may not really have a very clear physical cause, and they don't really get better with the usual things that people try to treat those things with. So how do we treat depression in the elderly? Well, there's many different things to do, and often we do a combination of these treatments, because every person is different, and every person responds differently to different things. So clearly, medications are definitely there for depression, and that could include seeing a psychiatrist, although, often your primary care physician is quite good at handling depression. Getting psychotherapy is a very important part of this. It doesn't always have to be, going to a psychotherapist's office. They now, especially for the elderly, have opportunities to have in-home psychotherapy. And clearly now, there's online things for having therapy, including group therapy and peer support groups that can be individual or group. Some elderly folks do need case management, and that's somebody who helps to try to navigate all these different ways of treating the depression, to try to help them with the social issues that are going on, to help them really, connect properly with their doctors and therapists. And then, of course, if depression is caused by grief that is not getting resolved, because it's okay, we understand we're gonna be sad when we have grief, but when it's continuing and doesn't go away, that can be depression caused by grief. So, getting counseling and support around grief early can also help prevent and treat depression. Just being around people and having more activities can help with depression. And so, we are recommending, and you'll hear a lot about this later in the talk, about just having activities and socializing. So at BCH, the primary care practices do a lot to try to recognize depression in the elderly and to have ways to get them help. So we have a thing called the Patient Health Questionnaire, and some of you may have taken it. It's called the PHQ-9, that is used as a screen on every one of the Medicare wellness visits, and we can often pick up depression on those. Certainly, we don't only do the screening with the Medicare wellness visit. If someone comes in and we're suspicious they may be depressed, or we see some of those things that I talked about that can kind of mask depression in the elderly, we'll often do one of these then as well. So then what do you do? What do you do about depression, especially in the primary care clinic? And who decides what to do? Well, every provider is different and every patient is different, and it has to do very much with the relationship between that provider, their patient, and how comfortable the provider is helping to treat depression. So some of the things that the provider can do is, if they're comfortable with it, start medications, or maybe somebody's seeming a bit depressed but isn't at that point where we think it has to be treated, and we can kind of just watch and check in and make sure everything is staying pretty stable. The wonderful thing that we have available to us at BCH is our integrated behavioral health team. And we can, and I'll talk about that more on the next slide, but we can have one of our behavioral integrated health people help us with the patients with depression. So every primary care clinic at BCH does have some level of integrated behavioral health. It's been a little harder during the pandemic because we used to always have someone who at least part of the time was physically at the office. And so that made it so if we had somebody who was in distress, we could often have the behavioral health specialist meet with them right then and there and get started on things. That's been harder now with the pandemic because the behavioral health specialists have to be off-site. But we can call them immediately if we need them for more crisis situations or for something that doesn't need immediate attention. We send an email or a note and have them contact the patient. So being able to have somebody come in and help with this without trying to go, oh, well, we need to find you a therapist out in the community or a psychiatrist out in the community. I think all of you realize that can be very difficult, and especially if the issue is insurance and someone doesn't take it and you can't afford to pay out of pocket. This is something that we have as not only a stopgap measure, but also to help find the proper resources down the line. Well, now, how do we look after our mental well-being? there's a lot of stuff that we can do. First of all, it's really important that if we have problems and concerns, we learn to talk about them and not just keep them inside. So who can you talk to? Well, you can talk to a counselor or a therapist or a religious figure that you trust. You can talk to friends and family, somebody with specialist knowledge, your doctor, a therapist, someone like that. And then also a lot of people reach out to support groups, especially during times of change. So for instance, if you're suddenly going to now move into a senior living situation instead of being at home, there often are support groups at those facilities for people who are adjusting to this change in their life. And it's really important to say what you feel and not say what people think, what you think people want to hear. I mean, I can't tell you how many times I've been talking to someone who I suspected might have depression, and it's, oh, I'm fine, I don't want to bother you. Really, please tell us if you're not feeling right. And listen to other people. And if you hear things from someone else saying, oh, this is what depression is like, and you go, oh, wait a minute, I'm having some of that. Please learn from that and know that there's help for you. One of the hardest things with aging is coping with change, and we do need to learn how to do that. So there's some really simple things, and I don't mean to make these sound trite, but it's important to really focus on the things you're grateful for, and then also, if you're having negative feelings, to acknowledge those and process them and say, okay, I understand why I feel like this, but I don't have to feel like this. And not to sound like AA, but then accepting the things you can't change. It works for everybody. If there's a silver lining in something, look for it. So, a lot of people who've been stuck home with the pandemic, for instance, say, I really hate not being able to be out, but man, I've read some good books and I finally, learned how to knit, or things like that. So even in bad times, there are often these silver linings. The other thing that's important is we need to take daily action to deal with our life's challenges. We can't just kind of go, okay, I'm just going to let it go by. I mean, it's going to take an active thinking about things, changing things you can change, not over worrying on things you can't change. Staying physically active has been shown to be an amazing way to help prevent depression. Regular physical activity and exercise raises your self-worth and boosts your self-esteem. It makes you feel more confident about yourself. It gives you something to do. I mean, a meaningful activity is important. Sleep does get better if you exercise regularly. Certainly, we don't want you to exercise right before bed, but sleep does improve your mental health, your mental well-being, and avoiding depression. And the exercise helps you sleep better. There have been studies that have shown that staying physically active really does help your brain. It helps prevent memory loss and cognitive decline, and it may help prevent or at least slow dementia. There's some dementias, I said I wasn't going to talk about that much, that are genetic, and keeping your brain active certainly can help, but it's not the be-all, end-all. It's not like if we all stay active mentally, we're never going to get dementia. So exercising, a lot of people go, well, I haven't been exercising and I'm older, and is it safe for me to do that? So the first thing is to check with your doctor first and make sure there's no reason you shouldn't be exercising, and also to kind of help figure out what kind of exercise makes sense for you. For almost everybody, unless they're having a lot of really bad orthopedic or balance problems, walking is a fabulous type of exercise, and it's pretty safe, and it usually doesn't hurt your joints. But it is important to find an activity that actually motivates you. So if walking is something that you just go, bleh, but riding an exercise bike while you're, reading a novel sounds good, then that's what you should do. It's very important that you just don't go, okay, I'm gonna start walking and tomorrow I'm gonna go walk 4 miles. You have to start slowly and build your strength up. And as I said about walking, exercise doesn't mean it has to be strenuous. And it's a way that you can have some social connection if you exercise at a distance with a friend, or it can be closer if it's a family member and you've been quarantining together. But it definitely is nice to take a walk with your masks on, with a friend outside. I do that when I can. Another thing that's very important to help us stay mentally healthy is to keep our minds active as we age. Certainly reading can do that. People like to play games, Sudoku, things like that, tackling puzzles. Those all are things that help the brain stay healthy. If you're not into those things, even just trying new recipes out when you're cooking, or if you like to do crosswords, trying one that's a little more challenging than you normally do. Trying new things is very helpful, including maybe trying to learn a foreign language or an instrument you always wanted to play in your youth. And then some people, especially during the pandemic, have taken hold of this by writing their memoirs or other writing endeavors, which is great. And they say that it's important to try a little something new every day. I mean, I don't know that we can really do that every single day, but with that in mind, we do things, we'll be able to do new things at least at some pace. And here, this is my hero, get plenty of sleep. Sleep is like my superpower. It really is an amazing thing for restoring your body and your mind. It's been shown that if we are getting good and adequate sleep, we'll have better mood, we concentrate better, our immune system is better, which is especially important in these times. So sleep patterns definitely can change with age, but there's also a lot of things that we do to ourselves that mess up our sleep. Pain, of course, can mess up your sleep. Certain medications can make it more difficult to sleep. Caffeine and alcohol clearly decrease sleep if used either in excess or at the wrong time. And unfortunately, a lot of us as we age do have to get up to go to the bathroom a lot at night. And if it's many, many times, that certainly can disrupt sleep. But if you're one of those people who has to get up once or twice a night to go to the bathroom and you get back into bed and you fall right back asleep, you're okay. And different people do need different amounts of sleep. And the way you can tell whether you're getting enough sleep is you should wake up in the morning and feel good and feel like you can get through your day without having to nap. So some of the things that you can do to help have healthy sleep habits are really simple, like making sure that your bedroom's quiet, making sure it's dark. So, if the moon's shining in constantly and it's time to get some curtains that block it a little more. And having a cool bedroom is helpful. I think they say that keeping your bedroom at about 60 degrees is like optimal. One thing that I think all of us struggle with is there's people who have the TV in their bedroom, or we're looking at our iPad or our computer, and it's really important to try to avoid that type of artificial light from screens for at least an hour before you go to bed. It's also important for a lot of people to really try to maintain a regular schedule where you don't sometimes go to bed late and then get up late, and other times go to bed early and get up early, just to try to keep your schedule of sleep at about the same time every day. Eating and drinking sensibly obviously is important for our health, and it's important for our mental health as well. The AARP did a survey with men and women over 50, and they actually found out that people who reported eating more nutritious and well-balanced meals also had a higher score on mental well-being test that they did than the people who said they rarely ate nutritious meals. So to do that, you want to really load up on high-fiber fruits and vegetables and whole grains, and eat at least 5 portions of fruit and vegetables a day. Sometimes when I say that 5 portions, people are like, oh, that's a lot, but it's not. When you think a portion, maybe just like a cup of the vegetable. So, and really try to avoid a lot of sugary foods and refined carbohydrates. The Mediterranean diet is a really good diet to follow because it follows these ideas. And I do have to remind people that alcohol counts as a sugary food and often counts as a carbohydrate. One of the things that I think many older people struggle with is staying hydrated. And part of that is because we actually lose some of our thirst response as we age. So, you know, why drink a glass of water if you're not thirsty? But it is really important for keeping the brain functioning properly and our joints and everything to stay adequately hydrated. So sometimes you need to tell yourself, oh, I better have a drink of water even though I'm not thirsty. So that's something to really consider. People sometimes ask, well, what's the proper number of glasses a day to have? Well, there's no really great data about that. You know, people always had that drink 8 glasses of water a day. But probably 6 is also reasonable, and it doesn't always have to be water. Other fluids count. So just, this is kind of embarrassing, but one of the ways that you can tell you're getting enough fluids is your urine should be fairly light in color. If you're taking certain vitamins, it can make your urine pretty yellow, but as the day goes on, you know, if you take your vitamin in the morning, it's not going to be interfering with your ability to tell what your urine looks like later in the day. The other thing that's an issue and has really become a big issue for people during the pandemic is trying to not drink excessive amounts of alcohol. The slide says, you know, for women, we don't want you to have more than 1 alcoholic drink per day, and that's true. For men, not more than 2 alcoholic drinks per day. But now there's new data for men over 65 that probably they should have the same amount as women. In other words, no more than 7 drinks a week, and preferably no more than 1 drink at a time. You know, obviously you can sometimes have 2 drinks, but that's the ballpark you're looking for. And then there is definitely a link between mental well-being and dementia. So having a purpose can reduce your risk of dementia, and the more active and the more you use and sharpen your brain, the more benefits you're going to get. And again, that I really want everybody to understand that does not mean you won't get dementia. You certainly still could, but perhaps it'll come at a later time in life than it would if you weren't doing these things. All right, and the third thing we wanted to talk about tonight was the pandemic and how do we really build resilience during this time. What is resilience, though? Well, it's basically being able to adapt to the bad things and the setbacks that happen, and we're experiencing a lot of those through this year. So the first thing is to be honest about how you feel about it. I mean, if you're frustrated and overwhelmed, or you're fearful or worried, it's okay to feel those things. You just need to recognize that that's what you're feeling. And with the pandemic, you know, the main thing that's happened to people because of all the stressors and stuff is a huge uptick in anxiety. And anxiety are unhelpful thinking patterns that we experience when our mind starts to fixate on a threat or on uncertainty or negativity. And it's actually the brain's survival mechanism because it's kind of one of those fight or flight sort of responses, but it can be really damaging if it's going on and on for things that, you know, are not real threats to our survival. And anxiety and stress can come together. Sometimes anxiety comes on its own, and sometimes it comes as a response to stress. When people are stressed or anxious, they often can get a racing heart or sweaty palms. And there is a condition called autostress, and that's when our body's stress response goes on for a long time. Autostress can cause a generalized anxiety. It also can cause symptoms of panic disorder type things where We have physical manifestations of our stress. So it could be muscle tension or headaches, or even chest tightness, difficulty sleeping, feeling really restless and not being able to relax. Some people get, oh, that's me, I'm sorry. Some people get heart palpitations. I was showing the heart palpitations. And other people get a lot of digestive issues, diarrhea, just tummy problems, just feeling, ugh. So what's on this slide are some unhelpful thinking patterns and some of the examples of them. There's a type of unhelpful thinking called threat scanning. And an example of this for the pandemic would be, always looking for the threats. So you're constantly checking your body, oh, my throat's a little sore, is that coronavirus? Oh, I am tired today, is that coronavirus? The other thing that can be part of that threat scanning is constantly checking the news about coronavirus updates. Another unhelpful thinking pattern is catastrophizing, and that's where you may feel chest tightness and your mind immediately goes to saying that you have coronavirus and your life's in danger. Now I want to say here, if you have chest tightness, don't necessarily ignore it. I don't want you to be having heart problems and ignore the chest tightness, but just a sense of a little chest tightness and then going, oh, this must mean I've got coronavirus is part of the pandemic issue that's going on. And also, catastrophizing is thinking, I'm gonna lose everybody I love to this virus. Hypothetical worry is another unhelpful thinking pattern, and it's where you kind of go beyond what you're already doing, things that are safe and good, but you still worry about it. For instance, I know I'm following all the guidelines, but what if I give somebody the virus? And then what if I'm standing there and somebody gets too close to me at the supermarket and I catch it from them? Yeah, those are possible, but to worry about those over and over is not helpful. There is a condition called emotional reasoning, where you have a sensation and it tells you, and then you think that it must be because of something else. For instance, if you feel scared, you think, oh, I must be in true danger, or I feel guilty, so I must have done something wrong. And then another unhelpful thinking pattern is fortune telling, where you say, I'm just gonna be stuck here for months on end, and my mental health's gonna just keep deteriorating and I'll have to go back on meds. Sometimes those may be true if you let them keep going like that, but again, it's an unhelpful thinking pattern. So we do have some tools that have been developed to help manage anxiety and these unhealthy thinking patterns during the pandemic. BCH has access to a website called My Strength, and My Strength is a great resource where you can use it to help track your feelings and your health. There's things on there to help you improve your mood and enjoy some interactive activities. There's some inspirational things on there with quotes and videos. The My Strength is available to all of you. So go to your computer and open the mystrength.com, and then in the right upper corner, click the thing that says sign up. And the access code that you can all use for this is BCH Community. Once you've done that, if you have a smartphone, you can download it either on your iPhone or Android devices at mystrength.com/mobile, and then sign in using the email and password that you created on the computer. And then you can have it at your side all the time to have a little inspirational thing if you think you need it, or if you're going through a tough time, to work through some of the resources and techniques that they have on My Strength. One thing, and today's a terrible day for this, that we've all suffered from is oversaturation with the media. Certainly that was the case with the coronavirus. I mean, today there's the political stuff as well. So it's very important to try to plan ahead on what you're gonna look at and what you're not. So you need to decide for yourself which information sources are you feeding into your mind and how often. Obviously, you want to, if at all possible for the pandemic stuff, you want to stick to a credible source that you can trust. So we recommend the Center for Disease Control, the Colorado Department of Public Health and Environment, and our website at BCH tries to keep up to date on all of that as well. Where people get into trouble is checking the news constantly. So try to use those trusted news sources only once a day if possible. So how do we control those responses to the hypothetical worries? Well, it's kind of dividing them into what's in your control and what's out of your control, and accepting that the things out of your control are not things that you can necessarily change, and so worrying about them is not helpful. So I'm not going to go through all these, but you can see what things are out of your control and the things that are in your control. So try to focus on those things that are in your control, like eating well and exercising and limiting the information you're getting to what's important and focusing on what's important to you, and being supportive to other people and seeking support from other people. One thing that's been quite helpful for people during the pandemic is basically mind-body medicine, which, more simplified, it's basically using mindfulness and meditation sorts of things to help center and really improve your overall sense of well-being. BCH.org has a mind-body center, and they have some resources on BCH.org where you can learn how to do some of these meditation processes. Another thing, if you're not into that, is just making a scrapbook of some of your favorite practical wisdom quotes. And if you find your mind starting to spiral, you can grab that scrapbook and kind of read through the things to try to reduce your anxiety. Thought challenging is something that mind-body helps train people in, and there's a thing called the ABCDE technique. And the letters have to do with the first letter of the words to trigger what you're supposed to do. So A is attention. When you feel distressed, you have to stop what you're doing and actually pay attention to what's going on inside you. What's your inner dialogue? What is your mind telling you? And then believe is B. You do not want to automatically believe your own thoughts. That thought of I'm just never going to get over this feeling of isolation. Try not to feed those over and over. C is challenge. Try to diffuse your anxiety by broadening your focus. So what's the bigger picture? Is the thought that you're having fact, or is it opinion? And what might you do to help yourself feel calmer? D is discount. You need to acknowledge that the anxiety's been dominating your thinking and let those unhelpful thoughts go. E is exploring options, and that's saying, okay, now I've done that, but what would be helpful for me to focus on right now that would be healthier for me, and what options do I have available? Developing a regular exercise routine is a fabulous way to stay resilient and get rid of a lot of these constant ongoing thoughts that are not productive. We talked about going for walks. Some people do video workouts on YouTube. There's this thing called Yoga with Adriene, which is an online yoga program that a lot of people can do. Many people have gotten some indoor exercise equipment to use during the pandemic. I think Peloton has made $1 billion on the pandemic. And there's other ways you can do it. I mean, if you don't want to do that, I mean, even just kind of running in place or dancing to music is a wonderful way to do cardio exercise. They mentioned doing a workout with a jump rope, but if you haven't worked with a jump rope in the last 40 years, it might not be the safest thing to start with. It's good to stay socially connected, even though we can't necessarily be face-to-face right now. And we really do recommend that you try to connect with at least one person every day. So you can telephone a friend and chat with them. If you're good with technology, obviously doing video chats and even little Zoom meetings where you can have a book club on Zoom or a virtual happy hour. There's lots of things that you can do to be with other people, even if you can't be with them face to face. Distracting oneself is a really good way to reduce anxiety. And again, increasing your activity level and meeting your social needs is one way to do that. A lot of people, unfortunately not me, have done really well with getting into chores that they've been putting off forever during the pandemic, and it's very rewarding to get those things done. Again, we talked about trying new recipes. There's so many things online now that we have access to because of the pandemic. Like you can go to a museum almost anywhere in the world and see what's in it without physically having to go there. And then as we talked about, other people have started doing their own writing. Breathing is an amazingly important part of how we get rid of anxiety. Americans especially tend to do this really shallow breathing. And I think part of it is, at least for women, we were told the whole time growing up, to hold your stomach in. Well, you can't breathe right if you're constantly holding your stomach in. So shallow breathing, you end up only breathing in your chest. And you end up breathing too quickly because you can't get enough air that way. And sometimes you actually feel like you're not getting enough air. So go ahead and test your breathing. Put one hand on your chest and one hand on your belly and breathe for a few seconds. Which of your hands is rising? If it's your chest, it means you're doing that shallow breathing. So it's really good to learn how to belly breathe. When I have people start doing this, I often recommend you lie down on your back to do it to start, because it's easier to feel your stomach going out when you're lying down. And focus on breathing through your stomach first, so your belly rises when you inhale and it drops when you exhale. Now that doesn't mean you can't breathe with your chest at all, but start with the belly, fill up the belly, and then fill up your chest. There's a really good breathing exercise that you can do, and try to practice it like 5 to 10 minutes a day, or do it whenever you're feeling really anxious. And this is where you're gonna inhale gently, lightly, and slowly to a count of 4. Make sure your belly comes out as you do. So it's, and then hold it for a count of 2, and then slowly exhale through your mouth for a count of 6. And that's belly breathing. And if you do that over and over, for 5 or 10 minutes a day, or when you're feeling anxious, it can be incredibly helpful. Now, it's important to learn the belly part of it, because if you're just trying to do it up here, it's not gonna help you relax at all. You're gonna feel bad. Maintaining structure has been another important thing to help people build resilience. And that's because often you're like, well, I don't have all the other activities I normally did, so what the heck am I supposed to do? So it's important to think about scheduling your day. So one of the things you can do is, before you go to bed at night, write down the list of the things you want to do or need to do the next day. Not only will it be there, but also then you can let those things get out of your head so you're not thinking about them all night and having them interfere with your sleep. Having weekly goals is important to some people, and you can actually break tasks down into smaller groups, and it's very rewarding to just cross off the thing you accomplished, and it really does make you feel better. Take some time to just sit and be mindful and have a cup of tea and focus on your breathing. If you're working at home, tidying your workspace at the end of day can really make you feel better. There is research that shows that working in a cluttered environment really interferes with your ability to focus. And again, decide on that regular sleep schedule. And it's often helpful to also have an end-of-day ritual. And this is where the alcohol is not the solution. I mean, a lot of people think, yeah, the end of the day, I was really tense, I'm gonna have my cocktail, and that's my end-of-day ritual. Try to come up with something that doesn't involve alcohol for that end-of-day ritual. Maybe it's taking a warm bath. Maybe it's sitting and reading a little bit of a novel you've been reading. A really cool thing that was developed during the whole pandemic is this thing called the Coronavirus Anxiety Workbook. And it actually is a tool that will help you build resilience. It's got lots of stuff in it that helps you learn all of these different things we were talking about. And you can pull it up on the website that's listed below the book here. So that's it for the talk, and I really thank you. And are there any questions?
Thank you so much, Dr. Lipetz. We're just going to give the chat about a little bit of time to catch up for any questions.
Okay,
right.
Thank you.
All right, we have a question that came in. Does taking hormones prevent mental problems?
No, not necessarily. I mean, is this a person talking about postmenopausal hormones for women? Yeah.
They hadn't
You're not sure.
Not
okay.
sure about that.
So, I mean, it really depends on what you're talking about for hormones. I mean, there aren't any particular hormones that, quote, prevent mental problems. I mean, certainly if you're having symptoms that can be relieved by the hormone, that may make you less likely to have then the development of feeling anxious or depressed. But the hormone itself isn't necessarily preventing.
Is there, what about pets with dealing with anxiety and depression?
Yes, pets are incredibly helpful. So, if you're lucky enough to be able to have a pet, that is so helpful in terms of helping prevent anxiety and depression. I mean, having a pet, just petting a dog or a cat, unless the cat attacks you, it lowers your blood pressure, it gives you this sense of well-being. Having a pet during the pandemic is probably one of the most wonderful things that can happen to somebody, because there's somebody else there who you can care for and who cares about you. So yes, pets are a great addition.
Can you give a few suggestions about how to raise the subject of mental health counseling to a grown child? Yes.
So if you're worried about either your mental health or your grown child's mental health, I mean, again, the most important thing is to be honest and open, and to say, hey, I'm worried about you. This is what I've observed. I think maybe you're depressed and maybe you're anxious, and to try to help them realize that there is a problem and help them move toward mental health counseling. Crisis intervention is a whole different thing. So if somebody is really in crisis, then there is a phone number to call for a crisis line or a place to take them here in Boulder if they're in an acute crisis. So it's a little different whether it's just, yeah, you need some counseling versus a crisis situation.
Okay, I'm just going to check and see. This person has a question. I am usually uncomfortable around friends. How can I overcome this?
So, I'm sorry, they said they right now are unusually uncomfortable around friends, or always?
They say, I'm usually uncomfortable around friends.
Okay.
How can I overcome this?
Okay, so, you know, that I have to kind of read into it, whether they're talking about they're uncomfortable being around their friends during the pandemic because of concerns about exposing one another. You know, that's valid. You know, I think as long as you really try to make sure that your friends honor your wishes about distancing and mask wearing, that hopefully you'll be able to interact with them without feeling super uncomfortable. If they're not being good about that, you should feel uncomfortable, and it's okay to feel that way. And then maybe those friends are the ones you want to talk to on the phone or do a Zoom call with, rather than, you know, feeling like they're in your space.
Okay. Another question here, and it's a very apt one. I have anxiety about getting the COVID vaccine. Any thoughts on overcoming this?
Yeah, I mean, I think there's a lot of people who are nervous about it, and part of that is because, again, you know, the media brings up some things that are unlikely to happen or rare, and then, of course, there's, you know, the conspiracy theories about the vaccine. So the way to get over it is, you know, if you're not quite comfortable yet getting the vaccine, to, you know, talk with friends or doctors who've had the vaccine and ask about their experience. And, you know, the fact that everybody so far that I know, and I've had my first shot, not my second one, is doing absolutely fine. And we have every reason to believe that the science behind the vaccine was done very carefully and very appropriately. I know it seemed like it was fast, but they were already working on a lot of the things that went into this vaccine before COVID hit, and then were able to adapt them to the COVID virus. So, you know, if you're super uncomfortable about it, then waiting a little bit longer until you feel a little better about how everybody else is doing when they get it, I think is okay.
I'm just going to give the chat a second to catch up, and we will get on with the questions.
Okay.
Thank you.
You can all practice your breathing while we're waiting for this.
There's another question here. Hold on one moment. How will our older adults know when they'll be, how will they be notified about when they can get the COVID vaccine?
Okay. So that is in constant flux because more and more things are happening. Certainly people who are patients in the BCH system will get notified when they are able to get it. In fact, there may be a new announcement tomorrow that tells more people, you know, how they can sign up. If you are on the BCH portal, you will likely get a portal message saying you're eligible to sign up, here's how you sign up. Now, people out in the community who aren't BCH patients, there's going to be more and more coming from Boulder County. And then also we're hearing that now a lot of, well, not a lot, but some of the chain pharmacies are being allowed to get and give the vaccine. So if you're a BCH patient, you'll be notified either by email or quicker on your portal if you can do it, because then you can even sign up for the vaccine on your portal. But otherwise, just keep watching the BCH website, keep watching the Boulder County Health Department website, and hopefully, more information will be out in the newspaper as well as things come. It's still building up. We haven't gotten to that perfect, how do we do this perfectly yet? But we are getting there.
And Dr. Lipetz, this is going to be our last question for the evening. What are your thoughts on medications for depression and anxiety?
I think many times they're very, very useful. I certainly am not hesitant to have my patients on medications for depression and anxiety if it's clear that either we need something to get them feeling better quickly, or that we've already tried straight therapy and it's not helping. And the medications really can give a lot of relief more quickly than if we do without the medication.